The arm, the humerus, and the elbow should be as close to his side as possible. So having a high-low table, that a little bit lower, so its shoulder isn't so hiked. Okay. If this was my real situation, I would probably ask him to stand up, and we would do this standing up. But if we're just going to sit here, so active range of motion is what active range of motion is. So I'm going to ask him to lift his arm up. Okay. Now, when you lift your arm up, don't let your fingers come backwards with you. There you go. That's a little bit better. Can you get this part to relax too when you come up? There you go, and as high up as you can go. Any changes in your symptoms with that? Okay. Can you point your wrist down as far as possible? Excellent. Can you bring your wrist in across that way and out the other way? Any changes in any of your symptoms with any of that? No. Okay. If I'm expecting the answer to be no, then we kind of go one into the other. When you're expecting the answer could be anything, because this is where he's really having his pain, it's really important you ask after every single motion, right? So that's that. All right. As far as the passive range of motion goes, what you want to do is you want to make sure his forearm and wrist is supported. So you might just stabilize here. If I have the table helping me, I might just stabilize here. For extension, I'm just going to bring the wrist up. Okay. Now again, allow the fingers in this instance to relax over my hand. So wrist extension. For flexion, I'm just going to take my hand and flex. And if I'm hitting the table, I need to make sure that doesn't limit my motion. Stay there 5 to 10 seconds, okay? Ulnar deviation. And it's got to be passive. It's got to be passive. It's got to be passive. And radial deviation, okay? Once you get to the thumbs and fingers, that's when you're going to start doing the joints more individually. So for the thumb, if I was doing active range of motion of the thumb, if I really thought I was dealing with a thumb issue more than anything else, I can have them actively, as best you can. I need you to move your thumb that way for me. Can you do that for me? Good. Any changes in your symptoms? Okay. Now what I want you to do is pull it back as best you can. So go ahead, try that. Any problems there? Good. Can you bring your thumb across your hand like that the best for me? Good. Any problems there? Good. And then just let it relax. And what I want you to do is pull it up that way for me as best you can. That would be the active part, right? So passively now what I'm going to do is I'm going to stabilize the trapezium trapezoid. Okay, that is the distal row. It's because I'm going to do passive range of motion, and I'm really looking at the carpal metacarpal articulation for the thumb at this point. So I can do abduction. Stay there for 5 to 10 seconds. I can do adduction. I can flex him, and I can extend. Always ask and stay 5 to 10 seconds. Does that change your symptoms? Yes or no? I move down to the knuckle. If I was doing active, I can do active, but passive, I'm just going to stabilize the metacarpal and the proximal phalanx. At this point, we're just doing flexion. We're doing extension. Okay? Any changes to your symptoms? And then I can do the same thing for the last digit. Resisted wise, again, we want the thumb in a more neutral position. So if I'm doing carpal metacarpal resisted testing, I can do abduction first. If I'm going to do abduction, I need to adduct his thumb, right? So I think that's important to know. I think that's a very easy follow-up question that could be asked on resistive range of motion testing. So which direction are you pushing? Oh, I'm pushing the thumb into adduction because I want to test abduction, okay? So I'm going to try to push your thumb back this way. Hold on, let me move it. And so all I'm doing is just that, okay? And now what's going to happen is I'm going to try to push it the opposite way. Don't let me do that. So now I'm testing adduction by I'm trying to abduct his thumb. For flexion and extension now, what I'm going to do is I'm going to try to pull your thumb up this way. Don't let me do that. So he is flexing, I am extending him. And then last but not least, I'm going to try to push your thumb down. Don't let me push it up. Okay, and see, does any of that change your symptoms? Okay, and a person with like a de Quervain syndrome, you may see some things tease out there like that. Okay, so that's where that becomes helpful. Resisted for the fingers, I'm just going to push on each one. Okay, so flexion, extension, and then flexion, extension. Okay. Going back to the wrist, and I know I'm jumping around a little bit because I got into the thumb. And then, so passive, resistive for the fingers, you just do that for all of them. So for the carpal metacarpal joints, you're going to flex, you're going to extend, and then you're going to ask them to resist that, right? And you do that for all the joints, okay? And you would do that for all the fingers. Now, if you got 10 minutes and you got a whole manual muscle test, are we going to have you do all But we might say, you know, just all right, show us just on the first finger how you would go through that finger, knowing that you're going to practice doing all of them individually, right? So, all right. For the wrist, we always like the position to be in a neutral position, right? So for the wrist, the neutral position or the open pack position is actually with slight flexion. So you might actually allow the person's hand to sit in just a little bit of flexion. So what I'm going to do from here is I'm going to try to push your wrist down and hold up. Just try to hold and meet my resistance right there. Just relax it a little bit there. Just relax it a little bit. I'll tell you when. Okay, right there. Just hold your wrist right where it is. There you go. Keep pushing against me. So I keep him in that flexed position and see how he does. Any changes in your symptoms with that. Okay. Now what I'm going to do is I'm going to try to lift your hand up. Hold on, let me move you. My pressure is primarily over the distal metacarpals. I don't want to get his flexor digitorum and profundus really firing significantly here because I'm interested in teasing out the wrist flexors, right, the wrist extensors. So my hand placements would be there. For radial deviation, I got to push him into ulnar deviation. So I'm going to try to pull your hand this way. What I want you to do is keep your hand right where it is and don't let me move you. Good. And then for the last one, I'm going to try to push you in that way, and he already knows. Don't let me push you in that way. So your patients will figure it out. Good. Okay. You want to get a good, slow increase in the amount of pressure. You want to feel like he's really stressing that muscle and tendon, so you can get an assessment of what those motions are doing with that. Okay. Is that helpful for wrist and hand? Is it seeing it again and having a video now to kind of work it? It's a little jumpy, but I think you kind of see what